Over the course of a lifetime, the heart is believed to beat 3 billion times. This labor causes some wear and tear alterations in the heart's structure over time. Normal aging changes, on the other hand, are not the same as congestive heart failure. Heart failure, or the inability of the heart to pump blood, is mainly caused by disease. While it might happen immediately, it usually happens gradually and insidiously over time. Circulation is hampered as the heart fails, resulting in a series of increasingly painful and frequently crippling symptoms that are highly curable but can lead to death if left untreated. Congestive heart failure causes. Any brief increase in demand is usually met by the normal heart simply pounding faster and more energetically. Jogging, swimming, and other forms of physical activity, for example, place additional strain on the heart, which any healthy heart can handle quickly and effectively. When a burden becomes continuous or severe, such as in cases of chronic high blood pressure, the effort to keep pushing blood through inelastic blood arteries overtaxes the heart to the point of failure. Any local injury to the heart muscle, such as a blockage in a coronary artery or a heart attack, can impair the strength of the heart's contraction and lead to heart failure. Damage or a structural change in one of the heart valves, which can be caused by rheumatic fever or a bacterial infection and lead to internal blockage or valvular leakage, can also induce heart failure. Heart failure can be caused by a variety of conditions that aren't directly related to cardiac function. Severe anemia, for example, reduces the oxygen supply in the blood and may put the heart at risk by forcing it to circulate underoxygenated blood across the body at an increasingly tiring rate. An overactive thyroid, as well as severe vitamin B shortage, have been linked to heart failure. Chronic illness with recurrent fever can cause heart failure in people who already have a weak heart. Symptoms of congestive heart failure. Blood no longer circulates in an appropriate flow to the body's major systems when the heart's pumping power weakens. As a result, a slew of more debilitating symptoms emerge, many of which appear unrelated to heart disease. Some issues begin in the brain, where the body's respiratory centers begin to malfunction due to a lack of oxygen. The kidneys may also be unable to filter extra fluid from the circulation. Alternatively, the problem could be with the injured heart, which is unable to transport the now increasingly saturated blood through the circulatory system at its normal quick pace. As a result, water begins to back up into the lungs, liver, and other organ tissues, causing one of the most obvious indicators of heart failure: congestion. This is why the condition is commonly referred to as congestive heart failure by doctors. The following are the most prevalent symptoms. Shortness of breath. Dyspnea is the medical term for this symptom, and it is often the first indicator of heart failure. It usually shows up gradually. In fact, the patient is rarely aware of it until he becomes breathless when climbing a flight of stairs or must come to a halt at the conclusion of a short walk to collect his breath. Rapid heartbeat. He may also notice that his heart beats quite quickly on occasion around the same time. Another early symptom of heart failure is tachycardia, which occurs when the overworked cardiac muscle tries to compensate for its inability to pump the normal quantity of blood every beat by beating faster. Swelling. This symptom, which is caused by an accumulation of fluids, manifests itself as an unexpected and seemingly unexplained weight gain of 5, 10, or 15 pounds. The ankles are usually the first to show signs of swelling. They become swollen and bloated during the day, then return to normal at night. As the swelling worsens, additional weight on the arms and legs may become visible. Nocturnal breathlessness. This comes in two varieties, both of which are linked to advanced heart failure. The less serious and dramatic variety is linked to sleeping position. If a person sleeps flat on a bed with only one pillow, he may wake up coughing and choking. Being startled awake by a sense of impending suffocation is far more horrifying. This condition, known as paroxysmal nocturnal dyspnea, is characterized by a racing pulse and can continue anywhere from a few minutes to an hour or more. Treatment of congestive heart failure. The earlier congestive heart failure is recognized, like with other illnesses, the more likely treatment will be successful. This is why it is critical to be able to recognize the earliest signs of the condition and seek medical help as soon as possible. Your doctor will most likely advise one or more of the following steps. A thorough examination. The most successful way to treat congestive heart failure is to address the underlying cause, and a comprehensive evaluation is the best way to do so. If high blood pressure is the reason, for example, reducing it will almost immediately make heart failure more treatable. If the underlying problem is a heart attack, however, bed rest and a coronary care program may be recommended. Drugs. A medication called digitalis is an excellent treatment for progressive heart failure. Digitalis, when taken in tiny dosages, decreases the heart rate while also increasing the force of each beat, allowing each of these beats to flow more blood. Nitroglycerin may be administered in some circumstances to relieve discomfort. New vasodilator medications that widen blood arteries are also being used more frequently to relieve the strain on a failing heart. Fluid retention is treated with diuretics. Lifestyle choices. A physician may also advise weight loss, reduce salt intake because it causes water retention, and encourage the individual to rest periodically during the day if necessary. Summing up. Congestive heart failure, which is caused by a breakdown in the heart's ability to pump blood, is a very curable ailment if it is detected early and brought to the attention of a physician. It is a reversible syndrome that can be improved with adequate medication and lifestyle changes in most situations of early identification.